In return, NKF assisted the MOH and research centers by loaning about 60 hemodialysis machines and 6 portable water treatment systems, as well as PPEs, to help them tide over the shortage of machines. In Klang Valley, we also accepted non-COVID-19 patients from HKL, Islayang, and Hospital Sungai Buloh to create space for them to accept our COVID-19 patients. We had meetings and considered pooling staff to assist them, each other, in this pandemic. So this collaboration has helped to reduce the burden for all affected. Here, I would also like to pay tribute to NKF's hemodialysis and management staff for the handling of the pandemic. Staff took great risks in managing positive patients, and many had to work overtime or were sent at short notice to sister centers to relieve infected staff. Yang berhormat Tuan Khairy, ladies and gentlemen, we are returning to near normalcy now, and our annual dialysis conference is a testimony to that. I thank Dr. Thiru and Dr. Muhammad Iqbal and others involved in organizing this conference, and I wish all delegates a fruitful and beneficial meeting. Once again, YB, I thank you for taking time to spend with us this morning. Thank you.
Distinguished guests, ladies and gentlemen, and now for the moment that we've all been waiting for. It is my honor now to invite Yang Berhormat Tuan Khairy Jamaluddin bin Abu Bakar, Minister of Health Malaysia, to deliver his address and launch the 16th Annual Dialysis Conference.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Salam keluarga Malaysia, salam sihat sejahtera. Terima kasih Datin Subhana. Yang berbahagia Datuk Dr. Zaki Murad, Chairman of the Board of Directors, National Kidney Foundation Malaysia, Dr. Thiru Bantiran, Organising Chairperson for the ADC 2022, Dr. Muhammad Iqbal, Chairman of the Scientific Committee, Ms. Kaur, CEO of the National Kidney Foundation, puan-puan, tuan-tuan yang saya hormati sekalian. Pertamanya, saya merakamkan ucapan terima kasih kepada kepimpinan National Kidney Foundation kerana telah menjemput saya datang ke Annual Dialysis Conference yang ke-16. Saya diberitahu oleh Dr. Thiru tadi bahawa ini adalah kali pertama conference ataupun sidang ini dapat dianjurkan secara fizikal sejak 2 tahun yang lepas. Dan saya dimaklumkan oleh Dr. Zaki di kali pertama Menteri Kesihatan datang ke conference ini. Saya syukur, alhamdulillah, sebab puan-puan, tuan-tuan semua dapat berjumpa secara fizikal. Ini juga adalah tanda pemulihan negara kita daripada pandemik COVID-19. Ya, betul, walaupun angka kes harian masih tinggi, tetapi kesan penyakit COVID-19 ini kepada kita sudah mula berkurangan. Dan ini dapat kita lihat dari segi kemasukan hospital, kemasukan ke unit-unit rawatan rapi, dan juga kadar kematian, dan didorong oleh kadar imunisasi kita yang merupakan antara liputan imunisasi yang terbaik di dunia, yang meyakinkan saya sebagai Menteri Kesihatan untuk terus menggalakkan supaya negara kita dapat terus dengan pelan pemulihan, dapat kita terus buka dan pulihkan negara kita secara berperingkat, secara berhati-hati, tetapi tak perlulah kita toleh ke belakang dan kita semua ber-PKP semula. Saya rasa there's no need for that anymore. Kita sekarang ini sudah masuk ke fasa peralihan ke endemik. Bila endemik itu tercapai adalah sesuatu yang perlu ditafsirkan secara teknikal, tetapi kita sudah pun berada dalam peralihan ke peringkat yang endemik. Dan sekiranya kita terus dengan langkah-langkah dan strategi yang telah pun kita laksanakan di Kementerian Kesihatan dan juga di seluruh lapisan masyarakat, pematuhan kepada SOP yang berterusan, pemakaian pelitup muka, liputan dos penggalak yang semakin meningkat, liputan imunisasi kepada kanak-kanak usia 5 hingga 11 tahun. Dan saya baru saja maklum pada Datuk Zaki dan juga kepada Dr. Tiru, bulan ini kita akan terima ubat-ubatan. Sebelum ini tak ada. Sebelum ini hanya ada vaksin saja. Tetapi kita akan terima antiviral, ubat-ubatan yang baru saja diperolehi oleh kerajaan untuk kita mula beri kepada pesakit-pesakit COVID yang berisiko tinggi. Jadi senjata yang kita ada untuk melawan pandemik ataupun virus SARS-CoV-2 ini semakin banyak, dan ini mendorong saya untuk terus press forward with recovery, with reopening safely, and more importantly to shift the focus of public healthcare not just on COVID but also on non-COVID matters as well. Dalam tempoh masa 2 tahun ini, sistem kesihatan awam atau sistem kesihatan swasta juga, all of it has been largely focused on COVID, managing COVID and treating COVID patients. Satu ketika dahulu pada kemuncak gelombang Delta, kita tahu bahawa sistem kesihatan awam kita hampir lumpuh dengan tidak ada cukup katil, dengan tidak ada cukup alat bantuan pernafasan, dengan tidak cukup ada katil unit rawatan rapi dan sebagainya. Now it's largely under control, insyaAllah. Ya, dan inilah yang saya melihat. Saya tengok kepada angka harian, yes, I still look at the daily numbers. Tetapi yang lebih penting, saya melihat kepada capacity ICU kita. Saya lihat kepada home recovery kita. Berapa ramai yang sembuh, yang ada di rumah, yang tak perlu datang ke sama ada CAC ataupun ke PKRC ataupun hospital. Dan apabila kita dapati bahawa 96% daripada active case sekarang ini dapat isolasi di rumah dan sembuh di rumah dan tidak melebihi kategori 2, maka kita berpandangan bahawa this is something that shows us we can start to live with COVID. What we need to do, the strategy going forward, living with COVID, is to make sure, of course, the healthcare capacity is enough, sekiranya ada surge. But more importantly, and this speaks to your conference, is to ensure that we are able to protect those who are at highest risk. For people who have very, very minimal health issues and those who are below the age of 60, if you get COVID now, chances are you will get the Omicron variant. If you are triple vaccinated, yakni dah dapat dos penggalak, chances are your COVID illness will just be category 2, mild symptoms, and you can recover at home. What we are most concerned about are elderly people. What we are most concerned about are people who are immunocompromised. What we are most concerned about are people with chronic healthcare illnesses like end-stage kidney failure. So this is the group of people that we must protect right now. One, through vaccination. Make sure, of course, patients, especially those with chronic illnesses, have received their booster doses. It's tough. I wanted to have reached 70% of the adult population by now, but it's only about 65% of the adult population. Urban areas, West Coast, Lembah Kelang doing very well, northern states, East Coast not so well. So we have to continue to educate. Tapi yang ini saya minta tolong the fraternity to also advise your patients, your clients, and opportunistic vaccination also for people who come to hemodialysis centers, who can arrange for this so that they are protected. Yang kedua, sudah pasti, as I mentioned earlier, treatment protocols for COVID patients. So we have asked our clinicians at the hospitals, our ID physicians, to look at the best clinical care pathway. So if you are admitted with COVID, then we can treat the COVID and we reduce the mortality and the morbidity of COVID. So this is the strategy going forward. It's not to say that kerajaan is just a free-for-all right now. No, absolutely not. Even if you are healthy and you are isolating at home, you use your MySejahtera, the home health assessment tools of MySejahtera, you will get reminders, you will get SMS, you will get robocall, and if you deteriorate during your self-isolation, someone will call you and say, hey, come to the clinic or come to the hospital. So we will continue to care for people, whether they are self-isolating at home or whether they come to the hospitals. But the focus for public health care right now is to protect those who are most vulnerable so that we can get out of this pandemic as soon as possible. Sebab itu tuan-tuan dan puan, saya datang pada hari ini sebab seperti mana yang disebut oleh Dr. Zaki tadi, this is the second kidney conference I'm speaking at in a matter of 1 week. Some of you saw me just last week at the World Kidney Congress. I hope you're not tired of seeing me. But I decided to come because this is the sort of focus area that we must channel our resources back to after 2 years of COVID. I spoke at the World Kidney Congress about the backlog, how we're trying to reduce the backlog, how I'm trying to protect the public healthcare hospital capacity so that hospitals are not turned into hybrid and COVID hospitals again. Because the backlog is a lot. We've got, I'll touch on it in my speech later. So we've had 2 years of COVID. Now it's time for us to look at the other issues facing us in the public and private healthcare sector, NCDs, kidney failure, chronic kidney disease, and this is why I came today. It is heartening to see the resourcefulness of non-government organizations such as the National Kidney Foundation, which has continuously been working hard with donors to raise funds to provide subsidized dialysis treatment for underprivileged kidney failure patients. Dato' Zaki, terima kasih sebab bangkitkan isu tax exemption status tu. Memang tepatlah cakap depan Menteri. Lepas ni saya akan usahakan supaya dikembalikan status tersebut ya, untuk bantu National Kidney Foundation. Since 2008, NKF has screened over 600,000 members of the public through your Life Check mobile health screening programs nationwide. Dan itu pun saya akan cakap dengan sikap lah. Saya akan tanya kenapa ketat sangat dia punya peraturan sekarang on screening. Kidney disease is becoming a major burden globally, and Malaysia is not spared from this. Kidney disease is a common but silent and often under-recognized condition. In Malaysia, diabetes and hypertension are the leading causes of end-stage kidney disease. The overall prevalence of diabetes and hypertension among adults above 18 are 30% and 17.5% respectively. A population-based study reported that CKD stage 5 in Malaysia was 0.36% in people in that same age group. To address this, the Ministry of Health Malaysia has in place programs like the PKB40 program, which allows those in the lower income group, penerima bantuan sara hidup, to have access to free quality health screenings if you are above the age of 40. As of now, almost 5 million Malaysians are eligible for the PKB40 health screening. 5 juta yang layak untuk mendapat health screening di bawah program PKB40 free untuk Malaysians, tetapi malangnya uptake is only less than 12%. We must do more to ensure Malaysians take part in the screening services. But what we're going to do now is we are going to designate, and I will make the formal announcement, but I can say it now, the month of July this year will be a National Health Screening Month, where we'll try and get as many people screened as possible. And that will help you also, because that helps with early detection for chronic kidney disease. Chronic kidney disease is a significant public health concern, with an ever-increasing prevalence of CKD and end-stage kidney failure in Malaysia. The incidence and prevalence of treated ESKD has also risen over the last 25 years. The Malaysian Dialysis and Transplant Registry reported that 7,967 new patients received dialysis in 2015, but by the end of 2016 there were almost 40,000. If the present trend continues unchecked, the number of ESKD patients is estimated to reach more than 100,000 in 2040. The burden that this will cost the healthcare system is an estimated 1.5 billion ringgit and 3.2 billion ringgit respectively. Currently, approximately 8,000 new patients are diagnosed as ESKD annually, and most of these patients must undergo dialysis. Data has shown that in 2020, the cost of treating 50,000 patients undergoing dialysis is about 1.6 billion ringgit. This makes Malaysia one of the highest in the world with ESKD per million population. ESKD in Malaysia also affects the younger age group, and this leads to a loss of livelihood as well as economic contribution to the country. Fortunately, in keeping with key WHO indicators for universal coverage, Malaysian citizens can access subsidized dialysis services by the Ministry of Health, by university hospitals, NGOs, as well as local authorities. However, as you all know, I am a firm believer that we must look at the entire spectrum of care, and that prevention is surely better than just curative care. One of the ways to do this is, of course, to look at preventive and promotive medicine along the spectrum of care, not just in terms of screening, but also in terms of looking at the social determinants behind why people are not getting screened, why people are not getting the care. Are they coming from families which are in a particular socioeconomic group that prevents them from seeking the screening and the care that they require? Do they not have access to this? Do they have transport and logistical problems that make them unable to access the care that they want? One of the ways to combat this is to, of course, increase awareness of kidney disease and prevent its onset and its complication. Our Agenda National Malaysia Sihat program that we launched last year is a movement to educate the masses on NCDs and key lifestyle changes, but also trying to look at the social determinants on how to help them live healthier lives. The key to preventing the onset of other major diseases: not only must we live a healthy lifestyle, eat well, try to exercise, avoid unlicensed products, supplements, avoid stress, don't smoke, but also try to make that easy for people to do. Sometimes it's easy to preach, but it's not easy for people to do this for many, many reasons, especially social and economic reasons. If you have risk factors for getting kidney disease, ensure that you get your regular tests. Seek treatment from kidney specialists or nephrologists. If a person is unfortunate enough to suffer from end-stage kidney failure, it is important that they maintain a healthy lifestyle and learn to live well with dialysis. I understand that the best option for ESKD, apart from, of course, dialysis, is kidney transplant. I am aware that the rate of organ donation and transplantation in Malaysia is one of the lowest in the world, and thus people on dialysis may never get a transplant. So I mentioned just now that I'm going to do my best to push pledges this year, make it easier for people to pledge. Let's go big on getting people to pledge their organs so that we have more options for kidney transplant this year. In fact, I'm trying to get the in-app My Sejahtera button so that you can just press a button and pledge to be an organ donor. So every time you check in, you can just press become an organ donor. I would like to take this opportunity to thank the National Kidney Foundation for the assistance provided to the Ministry of Health, especially during the recent COVID crisis. Your assistance helped us to reduce the patient load at government hospitals, and this was effective due to the strong collaboration between public and NGO dialysis centers. In September of last year, we were facing a huge backlog of cases at KKM hospitals. Both surgical and medical, the backlog was 57,000. However, through public-private partnerships, we have managed to reduce backlogs by 33.8%, and now it's about 37,963 cases. We've been doing mass surgical initiatives. I launched one in Selayang the other day, mass urology surgery initiative. I'm going to Tawau on Monday to launch a mass cataract surgery initiative, so we can just clear these backlogs, getting the surgeons not just from KKM, teaching hospitals, private hospitals, come in and clear as much of the backlog as possible. Ladies and gentlemen, although there's no cure for CKD, the disease can be prevented or treated. And most importantly, the progression can be slowed. In line with this, KKM has launched a national action plan for healthy kidneys. It aims to prevent or delay the onset of chronic kidney disease whilst enhancing management of patients affected by the condition. It has 4 objectives: primary prevention, early detection and secondary prevention, to expand and enhance treatment options for patients with CKD, and to develop and maintain a strong research component to guide kidney health policies and practices. I briefly saw the scientific program. I'm glad that it looks the entire spectrum of care, including palliative care for kidney patients. It's important that every single spectrum of care is covered in how we treat our CKD patients. Our action plan also highly recommends strong collaboration with NGOs and government agencies to strengthen the management of CKD. The well-being of kidney patients, of course, cannot be taken lightly. The assistance provided by the National Kidney Foundation will help meet needs of kidney patients, especially since this is a growing issue not just around the world, but especially here in Malaysia. Once again, Dr. Zaki and friends from NKF, I congratulate you. I applaud your initiatives. This is in line with our call for a whole-of-society approach in tackling healthcare. To me, healthcare is not sick care, it's healthcare. We must make sure it's not just treating sick people. Healthcare is not dichotomous, either you're well or you're sick, you come and see us. But it's a whole-of-society approach. And I look forward to seeing more of this kind of initiatives and to many, many more years of success under the National Kidney Foundation. With that, dengan lafaz Bismillahirrahmanirrahim, allow me to launch the 16th Annual Dialysis Conference. Thank you very much.
Dr. Zaki, Dr. Kiru, Dr. Iqbal, and Ms. Kaur to accompany the Minister on the stage for the act of launch. Ladies and gentlemen, may I now invite you back to your seats.